When you don't know something about health, just shut up, right? So what is that component that's missing, right? And the component that is missing is actually health optimization. You are not sick doesn't mean that you're healthy.
Right.
It only means that you're not sick.
Right.
Barrel through those side effects in order to get to the weight that they want. The body is not dumb. The body knows how to balance itself.
Hi, my name is Dr. Scott Sherr. I'm a board-certified internal medicine physician. I'm certified to practice health optimization medicine and practice, as well as hyperbaric oxygen therapy.
Hi, I'm Dr. Ted Achacoso. I'm trained in pharmacology and toxicology, in interventional neuroradiology, in medical informatics. I have done artificial intelligence research, and I'm also board certified in Europe for anti-aging medicine and nutritional medicine, and trained in finance on socially responsible finance.
All right, Dr. Ted, so we're going to talk a little bit about nutrition today, and we're going to talk a little bit about Ozempic and the GLP-1s. Very exciting.
And then profit from the intervention, not from making people healthy. And there was a very clear, you look at Johns Hopkins, the guy that started that school, William Halstead, he denigrated nutrition, denigrated any type of holistic thinking. To this day in medical education, when my sister brought up that somebody with migraines might need to have a dietary intervention, her attending surgeon said, stop being a we didn't go to nutrition school. This kind of idea of delegitimizing any exploration. First day at Stanford Med School, Casey was told by her professors that the American patients are not going to stop eating their Big Macs, that they're going to be sedentary, and that the best thing we can do is stand with serious medicine, with the prescription pad, with the scalpel.
What do you think about that perspective on how nutrition and how things have changed?
Yeah, it actually begins with medical education, right? Because in medical education, we have essentially anatomy, physiology, and where they meet, you can't distinguish it within them anymore, is molecular biology, right? And then immediately we jump into pathology. So we're taught pathogenesis. And then we really only do things in medicine is prescribe drugs, and that's pharmacology, and do surgery, cut it out. And where those two meet are the combination procedures that are really quite more expensive for pharmacology and surgery. So those are the only elements really of our medical training. But as I say in my lectures, just because you are not sick doesn't mean that you're healthy.
Right.
It only means that you're not sick.
Right.
So what is that component that's missing? Right? And the component that is missing is actually health optimization. We're not taught how to optimize the health, right? In contrast, actually, there's pathogenesis that's being taught to us, but no one actually teaches us about salutogenesis. What are the root causes of health, right? And that is the missing view that's in there. And it all starts with how we're educated. And then we take how we're educated as gospel truth. Whereas we have a big hole in there where we don't know salutogenesis at all.
Yeah, so I mean, I've heard the arguments from medical administrators, for example, that there's so much to learn from a pathogenesis perspective, from a physiology perspective, that there's just not enough time to work it, even think about nutrition or even put that in there. Do you think that that's the case, number one? And then number two, do you also think that Americans just won't change and they'll keep eating their burgers and everything else?
The American Medical Association is a very powerful organization, right? What they say usually goes for everyone. I don't know how they amass such power, but it's basically the hubris of physicians playing God, right? For me, it's like, when you don't know something about health, just shut up, right? Why do you have to insist on what you know when the topic is actually about nutrition? Right? So, and that's the kind of attitude that's very arrogant. It's not just nutrition, it's everything else, right? What are the root causes of health? And that's really a problem with us here in the United States.
And we've discussed this as well, together with our group. And when you're thinking about health, what does that really mean for somebody compared to thinking about just disease, right? Like, how would you frame that for somebody that's different? Because most people think that they go to their doctor, like their primary care doctor, and they're getting preventative care, right? Because they're trying to test them early for diseases and try to look for markers of diabetes and cholesterol. What's different, though, from like a health focus?
Okay, in health focus, I love my definition of health. I give it away to people who would care. Because the World Health Organization's definition of health is just so broad broad that it's not clinical. So clinical definition of health for me, and where we've had some success in health optimization, actually a lot of success, is that it's A plus B plus C, right? As A is the absence of disease, that's fucking illness medicine, right? Plus B, the balance between the anabolic and catabolic.
Can you explain that briefly for people? What
process?
Is anabolic versus?
Anabolic is basically processes that make you grow.
Right.
Catabolic is processes that make you break down.
Right.
So in fact, even our lives are reflective of that. When you're young, you're getting into an anabolic process. When you're older, you get into a catabolic process. But on the whole, if you maintain that as a balance, then you will have a healthy life, right? And it comes not just from balancing inside a cell, you know, it goes all the way up. There are people who are specialized in parasympathetic, sympathetic balance, for example. And so it's a fractal concept, right? That just goes on. And the C is according to the cycle of life of the organism.
So explain that for just us.
So as I just said, you know, for young kids, they're basically anabolic, right?
Right.
And according to your life cycle, you know, the test results in illness medicine have a cutoff, right? Either you're this or that, right? But the truth is that everything comes in a range, right? Everything comes in a range. And what you're talking about earlier is actually a slide that I had where, you know, before you get into the disease markers, which we're so used to doing, you know, there are now health markers because the technology in the laboratory has grown. It's reaching our clinics, right? You check the metabolites that are being thrown out, and you could see exactly what's deficient, what's in excess. I call them subtle toxicities and borderline deficiencies. That's make you sick, right? But then it doesn't, you know, an imbalance makes you unhealthy. Right? And then you see that, you know, the genes, you know, by epigenetics and environment with your toxins, right? You know, time, like there's chronobiology, right? And there's energy production from your mitochondria, right? So mitochondria has its own DNA. So we also have to consider this beforehand. So in medicine, we're actually always looking at the gross. That's why we're divided into organs, right? You have the brain specialist, the heart specialist, the kidney specialist, and so on. But our level of health optimization, we say, well, okay, what's underlying all of this is the cell, right? So,
basic cell,
so we're essentially the people who take care of the cell for you, right? For example, if you are getting chemotherapy, right? Who's protecting your health, your cells, you know, that are non-cancerous to make them keep them healthy? So that's the position that I have in this. It's like there are more healthy cells in your body than there are unhealthy ones, right?
So we have to take care of those.
Just as it's an inevitability that we're going to get sick, even though we get much sicker than other countries. And then drug people, we're so in that box, it's like heresy to even question that we're going to do that.
And we should give the listener and Sean background. Basically, we had a discussion on Twitter, Callie and I, about Ozempic. I actually don't remember what I said, but I think...
How convenient.
Well, it was something, I was like pro Ozempic, but for people who were incredibly obese, because I think that like, I just think that when people say that something is always bad, I'm like, well, that's not true. Like it could be good in some cases. Now, I think that drugs are mostly not the answer, but occasionally are. I tested Ozempic because I'm a guinea pig and I love testing weird things. I think that like some of the things that for morbidly obese people is interesting. I think it's particularly interesting for alcoholics, but for the average Joe, no, I think it's silly. And I imagine you and I are in huge agreement on that.
Ozempic, I think it's the most popular drug behind like statins now in the United States. So it's everywhere. We have Hollywood stars using it to get those last 10 or 15 pounds for their movie roles. We have 700-pound people that can't move taking it. This is the GLP-1 category of medications. You know, my thought here is that there is likely a role for them. And I think that what we're going to see is that there's going to be a huge shift probably in the next 4 to 5 years of how people are going to be prescribing these. The issue is, I think, the massive fat loss that people get and also the lean body mass at the same time, right? And when you're not hungry, because the GLP-1s, what they do is they shut off your hunger, you just don't want to eat. And as a result of that, you're probably not going to get enough protein, right? And then they start like just wasting muscle mass very fast and fat. I mean, and there's dangers, right, to losing fat so fast.
Yeah, they don't want you to eat just like crystal meth, right? My take on this is that, well, why did people get fat in the first place?
Yeah.
Right? People in the United States, a majority of them are corpulent. And, you know, it's actually quite striking when you arrive from Europe and land back in the United States.
Yeah.
You could see like, oh my God, it's a land of corpulence. And for me, the first question is like, how did we get this way?
Yeah.
Right?
Yeah.
And then we got into the focus of instant weight loss. And because America is an instant gratification society, you know, they would actually take something with quite a, you know, defined list of side effects,
Yes.
right?
Yes.
And just barrel through those side effects in order to get to the weight that they want. And that's because, you know, we're obsessed with weight here. And in health optimization, we're actually obsessed with your lean body mass, right?
Yes.
And decreasing your visceral fat
Right.
rather than your subcutaneous fat,
Right.
Because that's more dangerous for you.
Yeah.
The thing is, we also have in this culture, you know, more is better. So for movie stars and so on, you know, they would just do this to lean up, right? Before they used to do cocaine, now
Yeah.
it's Ozempic, right?
Yeah.
So
those other bad drugs, like these, I remember phentermine, for example, which was one
Yeah.
a long time ago. And I remember being in the hospital and training and seeing these women come in
Yeah.
with severe cardiac issues because of taking so much phentermine. So
Yeah.
I think that's the other thing with GLP-1s, that they're still very new. We
Yeah.
don't really have a sense, especially at these higher doses that they're prescribing for weight loss, what the long-term benefits or side effects might be.
yeah.
And you know, I get concerned about that a little bit.
yeah, there are already studies about stopping Ozempic, right? And getting a rebound weight gain.
Yes, almost everybody does.
Yeah. My long-term view more is like we should address the causes of obesity in the country,
Right.
right? We should address, identify what they are, and mostly we know what they are, right? So you have, you know, food deserts in the United States.
Right.
So you cannot actually get nutritious food.
So I also like to point out to my patients and clients that losing weight very, very fast is also potentially dangerous. Right?
Yeah, because a lot of toxins are actually stored in your fat. You know, if you're a woman and your, you know, body mass index belongs to the obese category, then you could see that estrogen also as a hormone is actually stored in the fat.
Right.
You could see a lot of other hormones that are fat soluble that are stored in fat. So if you lose it very rapidly, you will actually, you know, release those in your bloodstream. They're nowhere to store, but in other organs, then you'd get all the side effects of the toxicity.
And there's a lot of inflammation.
It's not from the drug itself, but from the fat loss.
Right.
And as I said, you know, we're more obsessed with subcutaneous fat than visceral fat, where in fact it's visceral fat that's more important that you reduce. You know, subcutaneous fat is just subcutaneous.
One of the things I also think about here, along with the rapid weight loss, is that it does slow down GI motility as well. And I have had some patients that haven't been able to tolerate these very high doses, but I do have some ideas of what's happening in the longevity community. And there are some work that's being done. There's some work right now that's being done on very low doses, like, you know, microdoses of GLP-1s to potentially help with longevity. So I think that that's where things might shift, is that people might start using it not so much for weight loss, but as much more for, because there's some issues, there's some thoughts about cardiovascular disease, dementia, et cetera. So I think that there's some interesting things that are going on there.
Yeah, you know, with us in health optimization medicine, our first are what I call bioidenticals and bioactives. Like use what the body actually uses.
Yes, this is your stepwise approach.
Yeah,
That's number one. Yeah.
And then the second is use your, you know, your naturals, your botanicals, your fungiceuticals, and so on, right? And then the drugs are actually at the last tier.
Final line,
right? The final line. It's not that we're anti-drug. It's that let's explore the other things that the body is not dumb. The body knows how to balance itself. If we allow it to and assist it with our choices with what we eat, you know, or get into some program that will teach you how to do that, and then, you know, come to us for health optimization. You know, we'll supplement you with and give you advice on your lifestyle with a measured test, right? So you measure your metabolites, you balance the metabolites, right? And then after that, based on those results, this is actually measurement-based lifestyle advice, right? Because as I like to say, it's funny, you have a total vegan who is extremely obese as a patient, and says to me like, "Oh no, I'm a strict vegan," and then you see anserine in their test result, and anserine is actually found in chicken, right? So
it's those
liar.
influencers that are online and they can't change their persona. They get caught in the back eating chicken and like get all like tabloids and everything. But with the categories you just mentioned, I think the second category, so we have bioidenticals and phytoceuticals. And the phytoceutical category, there's one that's being now touted as nature's Ozempic. This one is called berberine. Do you want to talk a little bit about berberine and your thoughts there?
Berberine is also called golden seal, right? And I use it for my patients to actually wean them off metformin because, as you know, metformin is an antidiabetic drug, but it also poisons complex 1 of your mitochondria. So I give them metformin breaks. Like after 6 months of metformin and the complaints about weakness, right? They're like their weight loss, but they're very weak, right? Because they have no energy. So I actually shift them over to berberine because it's if you get a high quality berberine, it's 1-to-1 equivalent to metformin, right? In terms of being able to reduce your blood sugar, but actually, one of its major effects is actually as an antibiotic. It kills a lot of
antimicrobial.
And it kills a lot of the fungi and bacteria that is actually overpopulating your gut microbiota.
Right, and parasites too. So when we use this, when we're doing GI optimization, right, we sometimes use berberine as a way to help clear out the gut. But that's potentially a problem if you're using it for the long term, is you might decrease your colony forms and everything, right?
I separate actually those. I give a separate antifungal that's also natural, right? Polygonum cuspidatum.
Oh, nice word. I like that. Nice words, I should say. So with metformin, actually with berberine here, when we're talking about nature's Ozempic, is that even like a fair equivalent here? I mean, does it have any effect? I don't think it does on hunger itself, right?
It just, the immediate effect you'll get from it, and I advise my patients that are getting shifted to berberine to treat it like metformin itself, right? So you have to eat it with food, otherwise you will have hypoglycemia.
Right. I think even especially more important than metformin, because metformin doesn't have like the acute blood sugar drop typically that berberine will. So if you take berberine on its own in the morning, so people are actually using it for like increasing their fasting level. So like if they're keto or something or intermittent fasting, they use berberine in the morning. And I'm usually okay with that, but I do think that people probably should cycle off the berberine as well, right? Because we got stuff over time.
And also proven to add to berberine would be alpha lipoic acid, right? Because it's a real hypoglycemic agent.
Right.
And that's the one that's really a lot stronger for dropping your blood sugar.
And you also use chromium a lot too, right?
I do for diabetic patients,
So that's kind of your combination.
It's just for, the chromium is actually more for insulin resistance, which is studied for, right? And most diabetics are actually insulin resistant.
Right. Okay, so when it comes to GLP-1s, I think that there's definitely it's just new at this point. We don't know the side effects, the long term. There likely is some benefits, especially if people are extremely obese and they have no other way of losing weight. But I think the challenge is trying not to lose weight that fast and keeping up your protein intake, or else you start, wasting away. And then in the studies that they have shown, like they lose a significant amount of lean body mass. And if you lose muscle and you're thin and you fall, you're going to break a hip, and then you're likely going to die in the next 5 to 10 years, right?
Yeah, that's
shorter.
That's why I said, we're not, fat doctors or overweight doctors. We're actually more of a lean body mass doctors here.
It's the perspective shift always, right? And I think that's a big one, right? Because people are like, I'm so fat, or obese, or whatever the word is.
People have heard the preaching, right? The more muscle mass you have, the more you can burn off those energies, because the muscles actually need.
Right, and that's a big thing, right? We used to think that if you just cut calories, and that was like a longevity marker, but the problem with that is that people lose so much lean body mass.
And that was what I was referring to, right? In the United States, the sedentary lifestyle is actually quite prominent, and that's one of the first issues I think that you should address before you can even go to the Ozempic, and eating like non-nutritious foods, right?
Right.
They're calorie dense but nutritionally poor.
Right.
And we've said that many times. We know, but we never actually have programs that push that.
I have actually somebody that I know that was at a recent Ozempic, or the company that makes it, I think it's Novartis, that makes it, at one of their rallies, or like all their reps for the place.
Yeah.
And he told me that it reminded him of like the opiate things that we'd see on TV, of like the Sacklers, and how everybody's like rah, like Ozempic's the next, everything. We're gonna put it in the water, like LSD.
No, the cardiologist says put statin in the water, and then of course the psychedelic movement has to be LSD, and then now it's fucking Ozempic.
It's Ozempic, man. Just keep eating your non-nutritious, nutrient-poor food, and take Ozempic, right?
And take expensive Ozempic.
Yes. All right, thanks, Dr. Ted. This has been fun. Although we are physicians and we do have clinical practices, this information should not be thought of as your own personal medical advice. Please talk to your healthcare practitioner, find a good plan for you, and be safe.